my name's Nyrah. I'm a GP pharmacist and I'll be your host for today's health show on British Muslim TV. Now, last week we actually focused on women's health, the menopause. Today we're actually focusing on a bit more about cardiac health, cardiac arrest and CPR. It is a very important topic to talk about. We do need to raise a bit more awareness of how to identify a cardiac arrest, what to do if someone actually goes through a cardiac arrest. And to talk about this topic a bit more detail, we do have a really brilliant, knowledgeable guest. His name's Dr Nadeem Ackbarally. It'd be lovely to introduce him on and ask him a few questions. Hi, Nadeem, how are you?
Hi. Yeah, good. Thanks, Nyrah. Good. Thank you.
Please, introduce yourself to us and the viewers, a bit about what you do at the moment.
Yeah, so I'm a locum GP at the moment in Leicester, working in around Leicestershire, Northamptonshire, and as well as that, I do some urgent care and A&E work as well.
Lovely. I think a great initial question would be, what is a cardiac arrest? And, what actually happens to our body when we go through a cardiac arrest? Some people might have heard of the term, but what does it actually even mean?
Yeah, so a cardiac arrest is essentially where your heart stops beating, and therefore you can't get any blood pumping around to your vital organs and your brain, and there's no signs of life essentially. So that is what it is in a nutshell.
Perfect, thank you. And we read online, there's so many different causes of a cardiac arrest. There was all information about the COVID vaccine as well, and cardiac and stroke risk. And what are the risk factors for cardiac arrest? Can it happen to anyone, anytime?
So, yeah, so it's a good question. So sudden cardiac arrests are difficult to predict, and they can happen to anyone. They can happen to young people. It's been on the news, or it's been in the media recently with Christian Eriksen at the Euro football finals. So for those types of cardiac arrests, it's very difficult to be able to predict them. There are some causes of cardiac arrests that you can, I suppose, manipulate to try and prevent. So if somebody's got underlying heart disease, that puts them at an increased risk of having a heart attack, which may then go on to cause a cardiac arrest. So those would be the kind of preventable causes. But for a lot of the causes of a cardiac arrest, it's difficult to predict, really.
Yeah, lovely. And a lot of people think having a cardiac arrest it's such a rare event. What are the odds of actually having a cardiac arrest? Is there any kind of statistics out there to kind of highlight what are the actual chances? I know, is it more prevalent in certain communities, such as the South Asian community?
So having a cardiac arrest out of the hospital, so if you're not a hospital patient, is around 30,000 a year, and unfortunately less than 1 in 10 of those people will survive that, and that's even with adequate CPR, etc. So it is a problem that needs awareness, and people need to know what to do if they're faced with a situation where somebody's had a cardiac arrest. It's a bit more difficult to predict whether people are more risk based on their ethnicity, but we do know that people from South Asian background are more predisposed to having things like diabetes, high cholesterol, heart disease, and all these are factors that can be managed to reduce the risk of having heart disease that then can potentially cause a cardiac arrest.
Yeah, and you mentioned ethnicity, and I think gender also plays quite a significant role as well, because apparently there was recent updates saying actually it's more prevalent in men. Is that actually quite an accurate say to say that yes, a cardiac arrest is actually more common in men than female?
Yeah, I think it's about 2/3 of cardiac arrests happen in men, and a third happen in women. Whether that's because women are generally better at coming forward with medical problems a bit sooner than men, that's possibly part of it. lifestyle and diet probably plays a part in that as well.
Yeah, definitely. And just going in a bit more deep on a cardiac arrest, what are the signs and symptoms to kind of look out for? If you are walking down the street, you do see someone either suddenly collapse, what are the signs and symptoms you should be kind of looking out for to indicate that someone might be having a cardiac arrest?
Yeah, so the first thing would be that somebody's collapsed, and there'll be no signs of life, essentially. So the first thing you should do is try, obviously make sure that the area is kind of safe for you to approach, but trying to arouse them and see if they're alert. And if there's signs of life, there's, it's not a cardiac arrest. If there's no signs of life, then you need to sort of check for a pulse and see if they're making any indication that they're breathing. And if there aren't any of those signs, then the likelihood is that it's a cardiac arrest.
Yeah, it's nice that you actually mentioned that that acronym, because I actually just did a first aid training course, just like a little summary on cardiac health and noticing if someone's had a collapse. And there is a famous acronym. It's called Dr. ABC. And it's a really helpful acronym, for anyone actually. I think the D stands for danger, R response to check if they're breathing, retaliating, airways, and then you'll start compression. So if the viewers are at home, if you do have a laptop near you, I would actually recommend searching up Dr. ABC and what it means and when you need to actually use it. Now, we also heard of heart attacks. Now, cardiac arrest and heart attacks, are they two similar things, or are they completely different? I know loads of people might get quite confused between the two terms. What's the difference?
So a cardiac arrest is sort of the end point, if you like. So that's when the heart has gone under an immense amount of stress, regardless of what's caused it, and it's stopped beating for whatever reason that is. It could be underlying electrical problem with the rhythm of the heart. It could be a lack of oxygen, poison, serious infection and things. One of the things that can cause it is a heart attack. So the heart is a muscle, it needs its own blood supply, and there are various things that can cause a compromise to the blood supply. So and that's what I was talking about earlier about sort of reversible risk factors and things. So blood pressure, diabetes, cholesterol, all those things can lead to blockages of the arteries that supply the heart with blood. And if that happens to a large enough extent, that is what a heart attack is. And that is where the person's still usually conscious, but they're feeling, the chest, classical sort of things is chest pain, arm pain, the sweating, the nausea. And that's when the heart is not receiving enough blood. And if that doesn't get sorted out promptly, then that can then lead to a cardiac arrest.
That was a great explanation, and very simple and easy to understand also. And, thinking long term, what are the long-term complications of someone who's had a heart attack? We know they might even be on lifelong medications. What kind of support or monitoring would kind of UK GPs generally provide to someone who's been through a cardiac arrest or just been discharged from hospital? Is there a support network out there?
Yeah, so there's various charities out there for people that have had cardiac arrest, because obviously, as well as causing physical symptoms, it can cause mental health problems as well. Just physically going through that sort of scenario can be quite taxing. And I guess it depends on how much of the heart muscle has been compromised during that event. And that's the importance of the early CPR, or even before that, the early recognition of a cardiac arrest, the early CPR, the early defibrillation. The earlier all of these things happen, the more chance someone's got of surviving. And the sooner those things happen, the less likely or the less severe the complications can be. The further down the line you get with CPR, etc., then you're compromising heart muscle. That can lead to the heart not working properly, and that comes with its own sort of set of symptoms, breathlessness and tiredness and fatigue and things like that. But yes, it is a lifelong condition, if you like, post cardiac arrest and heart attack, with with medication. It depends what causes it, really, but if it's a heart attack that causes it, then it is lifelong medication. Yeah.
Yeah. Important to kind of highlight that, you know, there is that ongoing support out there. Like you said, you know, there are online healthcare charities. You know, there's so much information online now. You know, we have the Dr. Google. You can just Google your symptoms and signs, but, you know, it might actually scare quite a lot of viewers. You know, any trustworthy websites you'd actually refer viewers to learn a bit more about cardiac health?
So the British Heart Foundation website is a good one. The NHS website is one that we always advise patients to use. Patient.co.uk is a good one as well. Those would be the ones that I would advise, really. And in general for CPR, the Resus Council website is excellent for that. They've got videos on showing how to do CPR and how to use the defibrillators and things. So those would be the websites I'd recommend.
Perfect. Oh, thank you. I think that's been a really useful discussion for part one of the show. You've answered so much good questions so far. About treatments in part two, we'd actually be asking you to actually share your story. I know you have a really interesting story to share about your own personal experience with cardiac arrest, and one colleague or a friend that you actually saved their life. So that'd be so nice to actually talk to you a bit more in detail about that in part two. And I have a few other questions lined up as well. So please join us for part two. We'll go a bit more in depth with Dr. Ackbarally and cardiac health. Please tune in again for part two. If you can join our Facebook page every week. All our sessions are recorded and posted on both our YouTube and Facebook channels. Do you also have any questions about the show, about cardiac health in general, or any recommendations for any medical topics you discuss, you can send us a message on the number on our screen. During the part two, we ask Dr. Ackbarally a bit more questions. Please. Welcome back after the break. I'm your host. My name's Nyrah. I'm a GP pharmacist, and you are watching the Health Show on British Muslim TV. Now, in part one of the show, we actually introduced our lovely guest. His name is Dr. Nadeem Ackbarally. We introduced cardiac health and CPR. Now, in part one, we actually talked about what is a cardiac arrest, you know, difference between cardiac arrest and heart attacks. And part two, I thought it'd be nice to talk about how do we actually treat a cardiac arrest and what can bystanders do to help someone that's actually going through one. Be nice to introduce Dr. Nadeem again, and we'll continue on from part two. Hello, Dr. Nadeem.
Hello, hi.
So it'd be quite good just to ask you, you know, if someone was on the street, let's say they did have a cardiac arrest, how would a cardiac arrest be treated?
Yeah, so the first thing to do is acknowledge that somebody's obviously collapsed and they need help. So, you know, you would approach them. And the first thing we always say to people is make sure that the surrounding area is safe. You know, if this is happening on the street, is that, you know, in the middle of the road, are there cars around? If it's, you know, in a building somewhere, could there be electrics around, you know? So the first thing is, you know, you have to make sure that you're safe to help in that situation. And, you know, as soon as you feel that you're in a safe environment, trying to get some form of communication with that person. So even if it's just, you know, shaking them gently to see if they're awake and conscious and talking, then that's fine. I mean, in this scenario, we assume that they're not. So then you can feel for a pulse. So you feel the side of the neck. That's the best place to feel for a pulse, and to look for signs of breathing. So whether their chest is coming up and down. And if there aren't those signs, then, you know, you're in a situation where there's a cardiac arrest. And if you're excuse me, if you're on your own, then that would be the time to call 999 and say, I've got a person who I think is in a cardiac arrest. Put the phone on loudspeaker if it's a mobile phone, and then the call handler should be able to then talk you through those steps as to what to do. But then, yes, it's vitally important to get going with CPR and find out where the nearest defibrillator is, really.
Yeah, and we hear the term CPR. A lot of people hear the term in movies or see CPR being done in films or online videos. What is CPR exactly, and why is it so important to act really quickly?
So in a cardiac arrest, the heart's not pumping, so you're not getting any blood around the body, you're not getting any oxygen around to your vital organs, including your heart and your brain. So CPR is a way of almost mimicking that. So you're doing compressions on the chest. So, like you mentioned in films and things, you see people with their hands on the chest, pressing down on the chest, basically on the heart, to try and pump whatever blood is in there around the body. And you do this in a rhythmical way. And you do it kind of, the advice now is to just do it continuously, really. You can stop and do rescue breaths as well, but it might not be the right situation. Person may have vomited, or there may be blood around their mouth, so that takes less importance now. The main thing is to get on and do the CPR, and even that, you have to ensure that you're pressing hard enough and deep enough on the chest, but also letting the chest expand back, because the heart still needs its own blood supply, despite being in a cardiac arrest situation. So that's really what it is. It's trying to mimic what the heart would normally do in pumping blood around the body.
Great explanation, thank you. And my first aid instructor the other day actually said, when you are doing CPR, make sure you're actually pressing down at least 1 to 3 inches down. So it's pretty far deep, through the chest, and you shouldn't be concerned if any ribs break. Should that be a concern when you're doing the CPR, or what are the kind of tips of doing an effective CPR on someone that's going through a cardiac arrest?
Yes, that's a really tricky question. When we were doing it at, say, medical school, and when we do it on courses like the course that you mentioned, you often do it on mannequins rather than people. So it's really difficult to sort of extrapolate one to the other. And it doesn't feel the same at all. It's just one of those things that when you do it in real life, hopefully no one ever has to, but if you do, it is one of those things where if you feel the cracking of the ribs, that's probably a sign that you are pressing hard enough, and that they are adequate compressions. But it is also important to not go too fast as well. So around 100 a minute is what we say. And there are various songs that you can sing to the rhythm of to sort of time your compressions to. So the one that we were taught was, I think, Nelly the Elephant. That was when we were at medical school. I think more recently the British Heart Foundation and Resuscitation Council had the campaign with Vinnie Jones doing the advert, and that was to Staying Alive. But those are just sort of little aids to kind of help people know how many times they should be doing the compressions, because if you do it too slow, obviously that's no good, but if you're doing it too fast as well, the heart is not getting enough of its own blood that it needs to survive. Yeah,
definitely. And I've also seen your stories in the newspaper, so you've actually saved someone's life using CPR. Can you tell us and share us your story? Love to hear.
Yeah, so it was a couple of years ago now, on a Thursday night. Ironically, I should actually be there playing football now, but it was a 7-a-side football match, and it's a group of friends that we've played for years and years, and there was myself and another GP actually playing that day, and it was just one of those Thursdays where we were struggling for players. We didn't know whether the game was going to go ahead, etc. And the last player that made it go ahead was actually Dilraj, who had the cardiac arrest. So if it wasn't for him, the game wouldn't have gone ahead, and who knows what could have happened really. But we were playing, and he came up to me a short while before we were due to finish and said that he was getting some pains in his chest. I said, just take a break. If you're still feeling like this at the end of the game, I'll take you to A&E, because you probably need to have some tests, to make sure that it wasn't a heart attack. So he went and sat down. We carried on playing, and we didn't know, but he then went and got a football from another pitch and was kind of walking around. Then said to the goalkeeper, "I feel better, so I'm going to go home," and then walked out. It's a 7-a-side like goal, so there's lots of different pitches in sort of cage like type thing. So he was walking along the side of this, and then the next thing we heard was this shriek, and the goalkeeper had seen him just collapse, just sort of face planted on the floor. So myself and Ish, the other doctor, we just ran over to him, and between the two of us we checked whether there were any signs for life. Can't remember whether we checked if there was any danger or not. I think that probably in the moment got ahead of ourselves there, and established that there was no pulse, so we had to start CPR on him, and luckily we had a lot of other people around us. So one person called 999, one person went and checked if the football centre had a defibrillator, and we took it in turns to do CPR, and luckily they had a defibrillator. So we got the pads on quickly, within a couple of minutes really, although it felt like hours. And luckily he was in the type of cardiac arrest that could be managed with a electric shock, if you like. So we shocked him using the defibrillator, and within about 10 seconds he started sort of groaning and moaning and came to, and he was completely just didn't know what had happened. And then a few minutes later the paramedics came and hooked him up to the ECG, and he'd actually had a heart attack.
So you guys really worked as a team there. So you said you got some of the bystanders involved. It's really important that someone jumps on the chest compressions as soon as, and then whilst the others ring 999. I think you just highlighted the importance of everyone kind of doing their bit, staying relaxed and trying to get the 999 attention ASAP. And you mentioned defibrillator. What does a defibrillator do?
So the defibrillator is a machine basically, and you put two sort of pads on the person's chest, and that when it's switched on will look for any electrical activity going on in the heart. The heart is a muscle; it needs electricity to make it function really, and there are certain cardiac arrests where there's no electrical activity at all, in which case the defibrillator won't do anything, so you just need to continue CPR until you can get extra help, get them to hospital and try and work out what's going on. And in the event that sorry I don't want to disturb you,
the show very soon, but I think a last question I'd actually really wanted to ask you is why is it important that different community organisations and buildings actually register their defibrillator?
Yeah, so there's a national initiative now. It's been set up by the British Heart Foundation, the Resuscitation Council and the ambulance sort of service, that registers all the defibrillators on the national database, so that if the event of a cardiac arrest, somebody calls 999, that person on the other end, the call handler, has got all of those defibrillators to hand, so they can advise the person where the nearest one is, because there are literally thousands of defibrillators out there not registered. So there could be one down the street from where an event happens that could save somebody's life and we wouldn't know about it.
Right, thank you. So it's all used to kind of locate where that person is that needs that urgent help. Thank you so much, Dr. Nadeem, for coming on to answering all our questions. It's been a really useful, informative discussion. We will be back next week with a new healthcare topic. If you've missed both part 1 and part 2, you can watch a recap on our Facebook pages. If you want further information about cardiac arrest, you can visit the NHS website. We have loads of healthcare charities online. You can British Heart Foundation is a really good website. You can also go for further help. You know, they have a ring, so there is a lot of information out there. So join us next time. I'm Nyrah Saleem, and see you. Bye.